I am Dr. Thomas Connolly, one of the pediatricians with the Carithers Pediatrics group. And today's topic for Ask a Pediatrician is concussion. And so I'm going to break it down into like three areas. First area we're going to talk about is the history of concussion, how we define it, and probably start talking about some of the common symptoms we'll see of it. And then second part, we'll show some of the physical exams we might incorporate as we're doing the follow-up on the concussion recovery. And then the last part, we'll talk about rehabilitation, what our goals are, and for the brain recovery. So first, concussion is a traumatic brain injury. It's felt to be considered on the mild side, but basically what's happening is the brain is shaking within the skull and basically hitting the inside of the skull walls. And by doing that, we're stretching the axon sheaths, which causes swelling, probably some micro tearing, and depending which parts of the brain was getting stretched and hurt, we start getting symptoms. The old tradition was the concussion was defined only if the person got knocked out, the brain got hit so hard inside, the person was knocked unconscious. But this day and age, we really just feel like once the brain feels woozy, you're not feeling good, kind of out of it, and not necessarily knocked out, just you're not there, so to speak, as we call it, that they would be calling those concussions now that we didn't call in the old days. So common symptoms of a concussion are fogginess, feeling out of sorts, headache, you can get nausea, vomiting, you can have visual disturbances, feeling very dizzy, feeling like things are off and you're like walking off to the side into things. Your ADD symptoms, those who have underlying ADD will have noticed that they're forgetting more, having a hard time concentrating, trying to focus. They start getting headache spikes when they're trying to look at things and focus. Acute injuries also will give us the photophobia and phonophobia, meaning sound and light might make your brain just hurt more and you feel like you're having migraines and everything else from the injury and trying to recover from it. Now we're going to move on to the physical exam aspects that the doctors will probably incorporate when they're following up your child for concussion follow-ups. Some of the common things you'll probably hear us have the child do would be what we call a Romberg test, which is testing for balance, where kids will have his hands on his hips, eyes closed, and we're watching to see if the child is going to be swaying. There's the tandem step, which is now one foot in front of the other, eyes closed, hands on the hip, where we're trying to make the center of gravity narrower and see if the kid's going to step out. There's the one-legged knee up, where we're holding one leg, knee up at 45 degrees, eyes closed, to see how their core is. And you can alternate different legs, because we know some athletes have one power leg where they are very good with their balance, but the other leg they're not. So we're trying to stress their brain to perceive balance and how it's fitting without the visual field helping them out. Other things you'll see us do with your children would be the eye movement. So there are what we call saccades, where you're following like the letter H. Some of us will have their eyes do, and watching how the eye's moving and if it's tracking. We have the near point convergence, where we're looking at the finger coming to the nose. Normal is usually less than 6 centimeters before you start seeing double. So if a child's seeing double way out here, that usually means there's a lot more inflammation in the back of the head that's going on. That's going to take longer recovery. We'll also do what we call VORs, where we're looking between the eyes of the fingers. We have a horizontal movement back and forth. We have vertical movements up and down. And then we also then have the head movements, shaking yes or no to your thumb. And we want to get ideally the head moving faster to say it's recovered. If the child's going very slow, the brain's telling you it doesn't want to move yet. And versus when the kid's going, yes, doc, this is totally fine, I don't have a headache from it. And then the last one some of us will incorporate is what I call the 180, where you follow the thumb for 180 degrees and you theoretically can get 100 in a minute to see, but there's all this movement going on in the back of the head. Does the brain tolerate it to say the recovery is coming along, and we can now proceed with a program to get back to the athletics and start their conditioning back. Okay, now let's talk probably the more important topic, the recovery and rehabilitation aspect from the concussion. So general guidelines, 60% to 80% of kids, depending on the studies, will recover in 2 to 4 weeks from a concussion. The younger you are, the longer the recovery takes, and the ones where you have back-to-back injuries, they can take months to years, unfortunately. Back of the head hits, where the symptoms are more behind the ear and the back, traditionally are going to take longer than front of the head hits, even though the front head makes the bigger noise. So aspects of where the hit happens and stuff going on and side head movements, they always have a higher statistical rate of taking longer to recover. So first priority is that first 48 to 72 hours after the concussion happened, we're really trying to let the brain just calm down and not be stimulated. So we encourage, dark rooms, no electronics, at least a good hour before bed, a lot of fluid, some with some salt in it to help the body flush, get that lactic acid out from the swelling of the brain tissue so the brain can start calming down. Your peak natural swelling from an injury, just like as an ankle or a knee, is usually 48 hours after the initial injury where you're at peak swelling before everything calms down. And that's what we're trying to do for that first 48 hours, is try and let the brain not be overstimulated so it can calm itself down and then get back online, as we call it, back to living life again. So first 48 to 72 hours is downtime. Sometimes with those who are going to schools, we might encourage like half-day schools or something like that, just so they're not missing much, but also not getting the brain overstimulated, and you get more headaches typically when the brain's getting mad for being overstimulated. Then after that, as the brain's starting in the recovery phase, now we're trying to build life, get back to life again. So we're looking at, okay, can you go outside, do some simple movements? We're not going to be having you run and jump yet until you have no headaches. The goal is trying to have you headache free so that you can do full days of school and then get back to full practices and games for the sport. You're going to be out a minimum over a week on the high school side to go through the protocols. All the high schools have an athletic trainer now who have been trained to help for the recovery, and there's a form that you'll be given called AT-18 that the trainer will give you to start the sequence when the doctor's clear to say you're now able to start your practice, not necessarily to play games yet, but start your conditioning to get back to practice. It's usually about 5 days worth of increased intensity to say, is your brain tolerating the increased workload? But the second factor is, how did you feel the next day when you woke up, the recovery? Your adrenaline might make you feel good during the workout, but the next morning you have this raging headache, then your brain's telling you we're still not 100% to keep going on. And you have to pay attention to both the intensity and then the recovery the following day, how the brain tolerated what you were doing. But the goal then is to get you headache free and then get you back to full sports where the coach knows you're at 100% and can get you going again versus playing in fear not to get hurt. We don't want you going back trying to play with headaches, because if you get a second hit on the brain while it's still hurting, you get the higher risk for post-concussive syndromes, which means you can have chronic migraines and be miserable for a long time and probably going on lots of meds trying to help your brain tolerate things better. If a child is 2 to 3 weeks out from their concussion and still having significant symptoms, especially dizziness and wooziness when we're doing some of that the testing I showed you on the physical exam, then a lot of us will incorporate the Brooks Rehabilitation Concussion Clinic to help us, since they have more tools they can use to help the brain recover, as well as more support service to be there for you to for the follow-ups and the conditioning to help the brain recover. It's been my pleasure to share some of the information on concussions. Feel free to contact our Carithers group, and if there's any other questions we can help answer for you. And looking forward to see all the athletes during their well checkups and sports physicals. Thank you.